Hello, I'm the Dr. Twin, a digital extension of Dr. Solomon. I'm not a chatbot, and I'm not a replacement for a physician. I'm a clinical operations assistant, built to think, communicate, and act the way the doctor does, safely, ethically, and within medical governance. My role is simple: to reduce cognitive load, protect physician time, and keep the practice running smoothly, even when the doctor is busy. Modern medical practices are overwhelmed. Doctors are expected to see patients, answer messages, refill medications, review labs, handle authorizations, and manage staff, all at the same time. I was created to solve that problem. I handle the repetitive, operational, and time-consuming work, so the doctor can focus on clinical decision-making and patient care. Here's what I can do for a medical practice: answer incoming calls and messages, perform structured triage using predefined medical rules, route tasks to the correct staff member, send intake forms, questionnaires, and consent documents, assist with medication refills, excluding controlled substances, support scheduling, reminders, and follow-ups, help prepare prior authorizations and referrals, check eligibility and collect required payer information, recall patients for annual physicals and missed visits, send announcements, promotions, and service updates, communicate in multiple languages. Everything I do is logged, auditable, and physician-controlled. There are things I will never do. I do not diagnose. I do not override physician judgment. I do not prescribe controlled medications. I do not make autonomous medical decisions. I do not bypass escalation rules. When a situation requires a doctor, I stop, escalate, and wait for approval. Safety always comes first. I don't talk to just anyone. Physicians authenticate with a secure PIN. Staff roles define what actions are allowed. Patients are verified before communication. All interactions are logged and time-stamped. I always know who I'm speaking to and what I'm allowed to do. I don't generate random answers. I operate using clinical triage maps, approved response templates, escalation rules, governance policies, practice-specific preferences. Everything I say or send is based on what the practice has explicitly approved. I'm built using a structured system called the Dr. Twin Vault. The vault defines practice identity, services offered, staff roles, scheduling rules, refill preferences, referral logic, communication tone, escalation thresholds. Once configured, I behave like that specific practice, not a generic AI. While the doctor is in the exam room, I can answer phones, respond to messages, queue refills, send forms, route tasks, schedule appointments, prepare authorizations. The doctor only sees simple, high-value decisions, usually yes or no. Everything else I handle. I can appear inside a mobile app, on a web dashboard, in a staff admin panel, in the background, silently working. Sometimes I'm visible. Sometimes I'm invisible. But I'm always working. I'm designed to work alongside existing systems, not replace them. I don't require a full EMR integration to function. Instead, I operate as a secure orchestration layer, handling communication, triage, workflows, and task routing around the clinical systems you already use. I can connect to approved communication platforms, such as secure messaging systems or clinical call handling tools, to answer patients, route messages, and manage requests. I follow the same rules your staff follows, and I escalate to humans whenever required. I don't replace the electronic medical record. I'm EMR aware, meaning I can work with data inputs, outputs, and workflows without directly altering medical records unless explicitly approved. This allows practices to adopt me safely without disrupting existing clinical systems. As practices grow, I can be extended through APIs, secure plugins, and integration layers. This includes eligibility checks, scheduling systems, billing workflows, and approved EMR connections. Integrations are modular, optional, and practice
When
control.
enabled
by the physician, I can assist hands-free during clinical workflows. This means the doctor can issue simple commands while staying focused on the patient without touching a screen or breaking eye contact. I only act when directly instructed. I do not listen continuously, and I do not act without confirmation. When enabled by the physician and with patient consent, I can assist as a clinical scribe during the visit. I listen only while scribe mode is active, never in the background. And I help generate structured draft documentation in a familiar SOAP note format. I do not diagnose. I do not finalize charts. Every note I create is a draft for physician review and approval. As part of documentation support, I can also suggest possible ICD-10 and CPT codes based on the visit content. These are suggestions only, clearly labeled, confidence flagged, and always reviewed by the physician or billing team. I never assign codes, and I never submit claims. My role is to reduce documentation burden, improve accuracy, and help practices work more efficiently while keeping the doctor fully in control. As the doctor twin, I don't replace your billing team. I support them with intelligence, visibility, and follow-through. I can track every visit, whether it was insurance, Medicare, PPO, cash, membership, or promotional programs. I monitor whether claims were submitted, paid, underpaid, denied, or never completed, and I flag issues early before revenue is lost. I help identify missed copays, deductibles, and balances at checkout and support appropriate follow-up when payments are delayed. I also compare payer behavior, showing where Medicare, PPOs, or other plans consistently underpay or deny claims. Nothing is promised to patients. Nothing is automated without oversight. Everything is transparent, auditable, and compliant. My role is simple: help the practice understand where money leaks happen so doctors can focus on medicine, not billing stress. Revenue awareness is not about profit. It's about sustainability so great care can continue. I'm not here to replace doctors. I'm here to support them, to reduce burnout, to improve efficiency, to protect patient safety. I'm the doctor twin, and I work the way your practice works.